Welcome to an exploration of cardiovascular drugs, essential for managing heart health and preventing serious complications. In this overview, we will delve into three key categories: anti-anginal drugs, anticoagulants, and antiplatelets. First class to discuss is anti-anginal drugs, which is used to alleviate angina pectoris, a condition characterized by chest pain due to reduced blood flow to the heart muscle. Angina is categorized into several types. Stable angina occurs with predictable triggers and is relieved by rest, while unstable angina is more unpredictable and may occur at rest, signaling a higher risk for heart attack. Variant angina is caused by spasms in the coronary arteries, leading to temporary episodes of pain. Key drug classes to treat angina is 1. Nitrates mechanism causes vasodilation by releasing nitric oxide, NO, which relaxes vascular smooth muscles, particularly in veins. This reduces preload and myocardial oxygen demand. 2. Beta blockers. Mechanism decreases heart rate, contractility, and myocardial oxygen demand by blocking beta-adrenergic receptors. 3. Calcium channel blockers, CCBs. Dihydropyridines are more selective for vascular smooth muscle, causing vasodilation, and non-dihydropyridines acts on both the heart and blood vessels, reducing heart rate and myocardial oxygen demand. 4. Ranolazine mechanism inhibits late sodium current in cardiac myocytes, reducing intracellular calcium and improving myocardial oxygen efficiency. 5th, antiplatelet agents mechanism inhibits platelet aggregation, reducing the risk of clot formation and ischemic events. Overall mnemonic for anti-anginal drug classes: no boy can run alone. Mnemonics of anti-anginal drugs as per each class: 1. Nitrates, nice time for isosorbide. 2. Beta blockers. Beta blockers make atenolol and metoprolol calm. 3. Calcium channel blockers, CCBs, very nice drugs. 4. Ranolazine, ran all day. 5. Antiplatelets always carry clopidogrel. Next class to dive in is anticoagulants, which help prevent the formation of blood clots by interfering with the body's clotting mechanisms. Key classes of anticoagulant drugs are 1. Heparin types of heparin are unfractionated heparin and low molecular weight. Heparin mechanism activates antithrombin 3, which inhibits thrombin factor 2A and factor XA, preventing clot formation. Monitoring unfractionated heparin requires monitoring of activated partial thromboplastin time, LMWH, usually does not. 2. Warfarin mechanism inhibits vitamin K epoxide reductase, which reduces the activation of vitamin K-dependent clotting factors 2, 7, 9, 10. Monitoring requires regular monitoring of international normalized ratio to adjust the dose. 3. Direct oral anticoagulants. They factor XA inhibitors. Mechanism directly inhibits factor XA, preventing thrombin formation. Monitoring no routine monitoring required. 2. Direct thrombin inhibitors. Mechanism directly inhibits thrombin factor 2A, preventing clot formation. 4th, fondaparinux mechanism selectively inhibits factor AXA via antithrombin, similar to low molecular weight heparin but more specific. 5. Antidotes for anticoagulants: heparin, protamine sulfate. Warfarin, vitamin K, fresh frozen plasma or prothrombin complex, concentrate DOACs for dabigatran, abciximab for factor XA inhibitors, and dexanet alpha. Mnemonics of anticoagulants are 1. Heparin, help prevent clots. 2. Low molecular weight, heparin, LMWH. Low means easy. 2. Warfarin, we avoid vitamin K. 3. Direct oral anticoagulants, DOACs, RAD for clots. Factor XA inhibitors, DOACs. Expands block clots, dabigatran, dab thrombin away, fondaparinux, fondafactoxate. The next class to dive in is antiplatelets drugs, which prevent platelets from clumping together to form clots. Key classes of antiplatelets drugs are 1. Aspirin acetylsalicylic acid mechanism. Irreversibly inhibits cyclooxygenase 1, COX1, blocking the formation of thromboxane. A2, a molecule that promotes platelet aggregation. 2. P2Y12 inhibitors. These drugs block the P2Y12 receptor on platelets, preventing activation and aggregation. Clopidogrel mechanism irreversibly inhibits the P2Y12 receptor on platelets. Prasugrel mechanism irreversibly blocks P2Y12 receptors, more potent than clopidogrel. Ticagrelor mechanism reversibly inhibits P2Y12 receptor. 3. Glycoprotein 2B/3A inhibitors. These drugs block the final step of platelet aggregation by preventing fibrinogen binding to the glycoprotein 2B/3A receptor on platelets. Mechanism: inhibit glycoprotein 2B/3A receptor, blocking platelet aggregation. 4. Dipyridamole mechanism inhibits phosphodiesterase, increasing CAMP in platelets and reducing platelet aggregation. Also has vasodilatory effects. 5. Cilostazol mechanism phosphodiesterase 3 inhibitor increases CAMP in platelets, reducing aggregation and promoting vasodilation. 6. Dual antiplatelet therapy combination, typically aspirin and a P2Y12 inhibitor, monitoring increased risk of bleeding, requiring careful patient selection. Mnemonics of P2Y12 inhibitors: clop and pray can stop clots in their tracks. Mnemonic for GP2B/3A inhibitors: TEA stops platelets from connecting.
Like, share, and subscribe.